Hi everyone, my name is Preeti. I'm a registered nurse. In today's video, we're going to talk about respiratory alkalosis. So let's get started. Whenever patients are hyperventilating, when they breathe too fast, they lose a lot of carbon dioxide that will lead to respiratory alkalosis. The carbon dioxide level will go drop and the pH will be high. So pH will be greater than 7.35 and the carbon dioxide will be less than 45. Breathing too fast will lead to losing a lot of carbon dioxide. So, what will happen in this situation? How the body will compensate? So, what the kidney will gonna do? Kidney will excrete the bicarbonate, which is the base, and retain the hydrogen ion. In respiratory alkalosis, the patient is losing a lot of carbon dioxide. What is carbon dioxide? Is acid. We do not have enough acid in the body. In order to compensate, what kidney will gonna do? So kidney will retain the hydrogen ion, which is acid, and excrete the bicarbonate, which is base, in order to maintain the acid-base imbalance. So, what are the conditions that cause respiratory alkalosis? Keep in your mind one thing: any situation that increase the respiratory rate, when patients are hyperventilating, that will lead to respiratory alkalosis. In a situation like increased temperature, when patient is having fever, they breathe too fast, aspirin toxicity, controlled ventilation, when patients are on mechanical ventilator, the control ventilation, the high risk that patient might gonna hyperventilate. When patients are having panic attack, when they are anxious, when patients are in pain, during the pain, all the vital signs goes up, the blood pressure, heart rate, and the respiratory rate. When patient is having any neurological damage, such as cerebrovascular accident, pulmonary embolism, where there is a clot into the pulmonary circulation, that will the patient will try to catch the breath and hyperventilate. A high altitude, when we go on high altitude, the low oxygen level will cause the body to hyperventilate. Anytime we hyperventilate, hyperventilation means breathing fast. When we are breathing fast, we are losing a lot of carbon dioxide. Now, what will be the sign and symptom that patient will presenting with when patient is have respiratory alkalosis? First, we learn hyperventilation. Patient is breathing so fast, means tachypnea. The respiratory rate will be greater than 20 beats per minute. Other neuro changes you will see in the patient, such as anxiety, dizziness, confusion, and that might gonna progress to seizure as well. There will be some electrolyte imbalance, such as hypocalcemia and hypokalemia. Now, how the patient is having hypocalcemia in respiratory alkalosis? When the carbon dioxide level will drop, that will lead to the calcium bind to albumin. So we do not have a free calcium in the blood and the blood calcium level will drop. That will lead to patient having hypocalcemia. Now you will see the symptoms related to hypocalcemia in the patients such as muscle cramp and tetany. Another electrolyte imbalance the patient will have is hypokalemia, low potassium level, and that will put the patient high risk for dysrhythmia. How the patient is having hypokalemia? So what will happen during respiratory alkalosis? There is not enough acid in the blood. So what will happen? The hydrogen ion from the cell will go into the bloodstream, and from the bloodstream the potassium will enter into the cell. So that will lead to hypokalemia because the potassium is going inside the cell, and from the cell the hydrogen ion is coming out. So that is leading to hypokalemia. Whenever the patients are on hypokalemia, we have to make sure we watch the patient for dysrhythmia, put the patient on cardiac monitor. Now, what are the interventions? What we can do to cure this? So, first of all, see what is the cause. Hyperventilation, breathing so fast, it's the cause. So, we need to decrease that respiratory rate. If the patient is having panic attack, provide emotional support to the patient. Encourage the patient good breathing technique. For example, breathe with the patient. Tell the patient, when I breathe, you breathe with me. Because patient is breathing so fast, so teach them the good breathing technique. Rebreathe into a paper bag. Ask the patient to rebreathe into the paper bag. When the patient is rebreathing into the paper bag, what will happen? The same carbon dioxide patient will breathe inside because patient is not having enough carbon dioxide. If the patient is confused or having a seizure, not able to use the paper bag, give them the rebreathing mask. Give anti-anxiety medication or sedative to decrease the respiratory rate, and monitor the patient for potassium and calcium level as the patient high risk for hypokalemia and hypercalcemia. Thank you for watching. I hope this video will help you to understand respiratory alkalosis.